and welcome back to Courtney's Corner. I am your host, Courtney Harris, and today we will be discussing a very complex and interesting topic, mental health. I will be joined by two ladies who believe they may have a mental disorder as well as a therapist. Without further ado, let's get started. Hello, I am so glad that you're able to join us today. How are you?
Hi, I'm doing okay. Wow. I've never been on TV before, so I'm a bit nervous.
That's fine. Just relax and tell me what's been going on.
Well, for as long as I can remember, I've always had this intense fear of spiders. Like to the point where I start to panic. I can't breathe if I see or think of spiders around.
Oh my, that is a problem. When did this first start?
I guess it all started when I was 7 or so. I had a very trying experience with a spider. All I can remember is I was eating breakfast, looked down at my cereal bowl, and saw a giant black spider. I remember feeling like I couldn't breathe, started to panic and cried. Every time I see one, I get like that.
I am so sorry that had happened to you, but do not worry, we will figure out a way to help you. Now I want to welcome Dr. Cassie. Dr. Cassie, thank you for joining me and Kayla. I know that you were listening in the back. Please give us a synopsis of what you think Kayla is suffering from.
Of course. Well, from what I was gathering, it seems that Kayla may suffer from arachnophobia.
Arachno what?
About this, what we call disorder, through the DSM-5 or the Diagnostic and Statistical Manual of Mental Disorders. It's the 5th edition. It was actually created by the American Psychiatric Association. This one was published in 2013. In it, there are criteria that has to be reached in order to diagnose patients. For arachnophobia, symptoms would include an unreasonable and excessive fear of spiders, immediate anxiety, avoidance of spiders in any way or form, fear that lasts more than 6 months, and the condition is life-limiting.
That is a lot of info. What are some of the causes?
We believe that arachnophobia comes from an evolutionary response. Evolution suggests that arachnophobia, or a general aversion to spiders, is hardwired as an ancestral survival technique. Although it is normal, it's still irrational.
What are some ways to treat arachnophobia?
The most effective approach to dealing with arachnophobia is therapy. Medications such as anti-anxiety or antidepressants can also be used. Therapy being an attempted remediation, walking the patient through their fears, and getting them used to it. Like this.
And we're back. Now we have another guest. I would like to bring in Courtney. Thank you for coming. As you know, my show is aimed to help. So let's start off with what you've been experiencing.
Okay, the symptoms, I guess you could say, that I experience the most are seeing and hearing things. I mostly hear and see random people, adults, sometimes children. Sometimes I see them in my house and it really scares me. I go to tell someone, but they say no one is there. I also have these random thoughts that everyone is against me, and that also scares me. My friends and family say that I also laugh when I shouldn't.
I am so sorry that this happens to you, but do not worry, we will find a solution. Dr. Cassie?
Okay, so what I have gathered, Kermit, it seems that you may have schizophrenia. Schizophrenia is a disorder that affects a person's ability to think, feel, and behave clearly. Some of the things that you have said that you have experienced sounded much like hallucinations, paranoia, anxiety, and delusions. I also noticed the way that you were moving your hands, and it seemed like a form of disorganized behavior, which is also a symptom.
Oh, do you know these?
I use a book called the DSM-5. It has all known mental disorders, treatments, and causes in it. I would still like to give you an evaluation after the show if you're okay with that.
Maybe.
What about the causes? Why do people develop schizophrenia?
Research suggests that a combination of physical, genetic, psychological, and environmental factors which can make a person more likely to develop this condition. Some people may be prone to schizophrenia, or a stressful or emotional life event may have triggered the condition to present itself. Either way, there are many types of treatment options. The two most common are medication and therapy. Some medications that can be taken are antidepressants or antipsychotics, such as chlorpromazine.
No.
Well, I guess that's everything. Time to move to our next segment. Ask Wendy Williams.